Welcome to Afri-Aussie ILIAC, Inspire, Lead, Educate, Advocate for Change, our Voice Community Wellbeing Podcast. The show that features the voice of multicultural Victorians from diverse community backgrounds to ensure a collective responsibility in maintaining well-connected, educated, inspired, healthier, more resilient, and safer communities during adversity, such as COVID-19 and the winter flu. Together, we can go far. I'm Rebecca Mpande from Afri-Aussie ILIAC, the president and co-founding director. And today we are talking about staying well in winter with our guests Nadia Siotula and we have Zaliha. We also have a surprise guest for you at the end of the show, so make sure you listen all the way through. Nadia Siotula, her background is South Africa, and she is a wonderful, great, amazing community leader. She owns Coaching Training Academy. And her daughter, Zaliha, is a year 11 student. She is one of our current Girl Force participants. Nadia and Zaliha. We start with Zaliha. How can we stay safe during winter to reduce the numbers of COVID and the normal flu cases? What does the Department of Health say?
Well, the Department of Health says we can keep ourselves, our families well this winter by choosing to wear a mask in indoor settings, always meeting in well-ventilated spaces, making sure our vaccinations are up to date, which you can book now with your doctor or pharmacist. The Victorian government is also offering free treatment at respiratory clinics. If you're eligible, no Medicare card is required.
Wow. Welcome, Nadia. What does the Victorian government, through the Department of Health, say? Please speak in your own language. I understand as you come from South Africa, what is the home language which you normally speak at home?
Xhosa. The Victorian government says singakwazi ukuzigcina usapho kunye nabahlobo bethu kakuhle kobubusika ukukhetha ukunxiba imask kwindawo zangaphakathi soloko bedibana kwindawo ezinomoya owoneleyo. Siqinisekise ukuba ugonyo lwethu lusexesheni, nto leyo ungabhukisha ngoku nogqirha wakho okanye usokhemesti. Urhulumente weVictoria naye unikezela simahla unyango kwiikliniki zokuphefumla. Ukuba ufanelekile akukho khadi le-Medicare lifunekayo.
Oh, thank you very much, Nadia and Zaliha. In a minute or in a second, we'll also hear from our, special guests. And these are Rachel Mafuta and Rudo Catherine. We are yet to hear more. But for now, bye-bye. See you later. Welcome back. This is our community well-being, our voice, community well-being. Afri-Aussie ILIAC offers to the community. I told you together we can go far. And here now we have our special guests, Rachel Mafuta Talamaku and Rudo Catherine. Rachel from Goshen Place Farm and Rudo Catherine Clinical Support Services. Both of them have to give us a message. Now, Rachel, you come from Congo. You are African Australian. You speak, what's that language again?
Lingala.
Lingala. Is that right?
Yep.
Okay. The Congolese Australians have to get a message right in their language so that they feel they belong here, although they are in Australia. They should feel at home. What is the message from the Victorian government through the Department of Health? What do they say about COVID-19 and winter flu? How can we keep or stay safer?
Tokoki komibatela pe libota na biso pe baninga na biso malamu na tangu ya malili oyo. Na kopona kolata maske na kati. Na kozala tango nyonso esika mopepe ezali. Koyeba kozwa mangole na yo ezala na ordre. Okoki kosala appointment epai ya docteur na yo ata na pharmacie na yo. Victoria government azopesa traitement ya ofele ya mokono ya kopema pe ya tolo. Soki okoti kozwa yango oza na besoin médicaire te. Merci.
Oh, mercy. I wish I knew how to say that word properly. That is not Lingala. Is that French?
Eza Lingala.
Oh, Lingala again. You use mercy. Oh, okay, mercy. Okay. Well, told you there is a second guest this time. And we have Ruda Catherine, Clinical Support Services, registered. She is a health expert. Ruda, what does Clinical Support Services have to say in support of this project that AfriAussie Aliac is delivering in support with support from the Victorian government through the Department of Health COVID-19 Community Program? What do you have to offer?
Thank you, Rebecca. Well, Clinical Support Services has partnered with AfriAussie Aliac to deliver healthcare initiative in fighting against COVID-19 and the influenza virus. With our dedicated commitment, we shall create a healthy communities supported by a thriving healthcare system with seamless access to medical resources for sustainable health. If you're feeling sick, if you have any flu-like symptoms, runny nose, cough, fever, diarrhea, vomiting, make sure you do a self-test. You can access any self-care test from AfriAussie Aliac or from any pharmacy near you. If you test positive for COVID or for influenza, please make sure you isolate at home. You always have access to medical advice by calling Nurse on Call if you're based in Victoria or Health Direct if you're everywhere else around Australia. You can also organize a telephone consultation with your own GP or other virtual services. For all your self-care needs and purchasing and having access to a self-care kit while you're going through COVID or influenza, please visit www.clinicalsupportservices.com.au. Together, indeed, we can go far.
Together, we can go far. And here I've got a mask in my hands. Rudo, looks like the government has got N95 quality masks, not so? And did you know, Rudo, Rachel, that AfriAussie Aliac, with the support of the Department of Health, we have 420 quality N95 masks which are being distributed to our communities. Our voice, community well-being. Together, we can go far. Thank you for your contribution today. Bye-bye. See you in the next podcast.